Dr. E, welcome to the podcast today. I'm so happy to have you on. Welcome.
Thank you. It's an honor to be on. I really appreciate it.
Yeah. So let's dive right into kind of tell my guest exactly what it is that you do, what's your job title, and kind of how do you see your role day to day?
I do nothing. No, I'm just kidding. I just wanted to make sure everybody's awake. So I guess I would at this point call myself, so I'm a family nurse practitioner with a PhD in integrative medicine, which is why I'm called Dr. E, because my full name is Efrat LaMandre and really no one can pronounce that. So I guess at this point, I would call myself a medical entrepreneur. I have 4 different businesses, which we'll get into. So at this point, in order to encompass all of it, I would have to say I'm a medical entrepreneur. We'll start there.
Yeah, that's good. I like that title. And that's like the first time I think I've ever had a nurse practitioner call themselves that. So that's really, really cool. And a different like mindset change. So I guess I kind of want to hear what all your businesses are. Just take us through like the litany of things and the different hats you're wearing these days.
Okay. So to tell you like what they are, I'll just walk you through the journey because each one came out of a problem that then I wanted to solve. And then I decided to make a business out of it. So basically that's the trajectory. So I started, as most of your listeners have, as a nurse, med surge, then ER trauma and all that good stuff. Yeah. And then I became an NP. And I worked for 2 places, a community health center that specialized in the underserved population, which was amazing because clinically you have to really be on point because you can't just order 50,000 labs, right? It doesn't exist. And I also worked in an ortho pain practice. And what I realized really quickly is that I don't do well working for other people. If you ask me why I started all of it, is because I just don't do well working for other people. I don't like being told what to do. Yeah. And I didn't realize at that point that meant I have an entrepreneurial spirit. I just realized that I found it really restricting to like punch in and punch out. I think you alluded to that earlier. And that whole requesting time off and all of it just didn't resonate. So I used to get in trouble a lot, but I didn't realize that just meant I wasn't supposed to be somewhere else. So so that community-based center, I said to my wife, I said, we could do this. I feel like we could do this in New York because this was in New Jersey. Let's just open up a practice. And it happened to be that everything is divine intervention. I got a phone call from my kid's old pediatrician. And she said, hey, I heard you're a nurse practitioner. And I love nurse practitioners and I'm retiring. What do you think about buying my practice? And I was like, as luck would have it, I was just wanted to open up my own practice. So yeah, let's do it. Yeah. What's crazy is I decided to do it without looking into it at all, not realizing that I needed a collaborating physician. And I was like, yeah, sure. Let's have this transaction of which I have no idea what I'm doing. Let me sign this paper. Let me get your office and rent it, even though it has like wallpaper and like disgusting carpeting and I have no idea what I'm doing. Sure, this is a great idea. Yeah, my wife is like, oh, okay. So what you need is faith in God and a really good partner. This is all you need.
Yes.
So anyway, I opened those practice and quickly got a collaborating physician. And 6 months later, the law changed and we no longer needed them. So on that, see ya. And when I opened up, I went to the physician down the street and I said, hey, just letting you know, I'm opening up here, taking over for this doctor. And by the way, I don't mean to step on any toes. It's all good. And he said, oh no, in fact, I plan to retire next year and I would like you to buy me out.
So now you bought 2 practices.
So now I bought 2 practices. I moved the first practice I bought the building of the second one and I moved the first practice into the second one.
Okay, wait a minute. I have to stop you really quick. So how did you afford the building? Did you just take a mortgage? Okay, you took a financing.
I took a mortgage. Yeah, okay. Of course. So the first one was like a rental agreement. So I was able to manage it and then I paid for the equipment. By the way, for those of you who are wondering what it looks like to buy a practice, you can't really buy a practice because you can't really buy patients. That's illegal. So you make a transaction over good to know, right?
Yeah, good to know. Yeah.
So you make the transaction either over a building or over equipment, because patients can go wherever they want to go, right? So you are hoping that the practice that you purchase, that people will stay with you, but there's no guarantee. Okay, a little pearl there, clinical pearl.
Yeah, that is a little pearl.
For those of you thinking of buying someone out, the seller will often tell you, hey, this is what my practice is worth. And that's meaningless. That's not the price you pay. Because that is what's worth. How did you figure that out? I don't know. Blind luck.
Okay, wait, so that was the price.
It was more from a space of like, well, I don't have like, what you're offering. At the time, I wasn't savvy. Like right now, I know because I've bought more practices since then. But at the time, I was like, well, that's a great number. I don't have it. Goodbye. Like truly innocent. And then they came back and were like, well, how about this? And I was like, oh yeah, that works. That number works. But I've later come to discover that someone will say, hey, I make $1 million a year. My practice is worth $1 million. No, it's not. Your practice is worth $1 million with you in it, with you generating it. But there's no guarantee. You're not selling me that. Okay. So there's no guarantee. So that's not what it's worth at all. So it's actually a made up number. You can make up any number you want.
Yeah. Yeah. It's like a garage sale. Yeah.
It's a garage. Exactly right. That's a great analogy. Like, yeah, it was worth $200 for you to buy that guitar, but right now it's worth $5 to me. You want it? Great. That's exactly how you have to approach it. Yeah. And that seller could take it or leave it also, but there really is there's people who calculate formulas. It's not real.
Interesting.
So yeah. So then I bought the second practice. We had the transaction over the building.
Oh, okay. So the rental for the equipment and now the mortgage for the building.
Now I purchased the building. Okay. Right. And then there's habit, right? People go to the same place. And usually just because there's a new provider in town, they'll usually give it a try. And as long as you're good, they'll stay more or less. Some people will leave, but more or less people go to the same place they've gone for the past 20 years. Right. So So when you're buying a building with a practice, unless you're horrible, you're going to keep most of those patients. And both of them were pediatric practices, and I turned them into families. So now I was able to turn to the parents and say, hey, I could see you also, which is the advantage nurse practitioners have because we're certified in family. I can see the whole fam. Yeah. Right. Whereas before I was a pediatrician, he couldn't see the adults, but now I can. So we were quickly able to grow the practice. And then another provider reached out to me and she said she wants to retire. And by this point now I'm a mogul. So my 2 practices. Glad you realized that was a joke. So
I'm a boss now. So I'm like,
huge boss. Yeah, exactly. Glad you recognize. I've just entered the room. Thank you. So again, with her, she had this crazy number and I was like, great, good luck. That's not going to work out for me. And not from a space of being like a negotiator, just from a space of, I don't have that kind of money. And a year later, she came back to me because no one had what she asked for. And she's like, how about this number? And I was like, perfect, let's go. So I brought her practice into the building that I'm in. Okay.
So did you buy her building or buy her rental?
No, we had also over her equipment. We came to a number for her equipment. I took a lot of like her otoscopes, a lot of things that are rather expensive to get. And I didn't, so I took a lot of her equipment, and she sent a letter to her patients saying, hey, I'm retiring. This is who I'm recommending, right? So it's a recommendation. And if you need, for those of you who are staying, great, this is her new address. For those of you who don't want, she will be the one managing the charts, and people who wanted their records, whatever, my team managed that. Oh. And that was kind of how she transitioned. Most patients stayed. Some asked for their records. We gave it to them, because you can't, right? And you shouldn't be able to, right? You would never want, that's not a good idea. But for just that letter of, hey, this is who I recommend, here's her address, was worth the entire transaction. Because most people go where the doctor that they trust recommends. So the moral of the story is, 1, you can't buy practice. 2, don't be scared when they give you a big price, just walk away. And don't be scared that you can't fill a doctor's shoes, because you can, because you're awesome. And you're going to do everything right for your patients. So don't be scared.
You know what? I love those little pearls because, again, there are nurse practitioners listening that are trying to process through, like, what does that look like? How do I get started? And I think a lot of nurse practitioners aren't really taught. It's kind of crazy how to practice autonomously in school. Yeah. Like, it's not brought up. It's just kind of like, all right, so all your clinicals will be with a doctor or a nurse practitioner working in the hospital. We'll only kind of show you this really myopic view. And you'll only walk away with this understanding of these are my options. And so by hearing you say, like, no, I just believed in myself. I believed I could do it. I, just kind of came up with this plan and I let the pieces fall where they may. And I figured out as I went along. These are all things that nurse practitioners need to hear to kind of get their, guts going, that I can do this. I can open up a practice, because there is so much fear.
That's what it is. If you are thinking, oh, the docs know more in business, they don't. They also didn't learn business. So I teach at the local college here, and one of the classes I teach healthcare policy and finance, but I always dedicate one class to opening up your practice. And this is what I say. If I describe what it's like to open up your practice, and if after all of this that I say, you are still salivating to open up a practice, then do it. And if after everything I described, you're scared to open a practice, then don't do it. But either way, like, just be one with that decision. Like my wife's a PA. She does not have the entrepreneurial spirit at all. She does not want to own her business in any capacity. And that works for her. So, if you're in this, like, I'm not sure if I want to or not, when you listen to this podcast, somebody who has that spirit, every time they hear a story, they're going to say, oh my God, I wish that was. And other people are going to listen to it and say, I don't know if I could curse on this. Holy sugar.
We're clean on this podcast. Holy sugar.
Okay. Holy sugar. This is the most terrifying ish I've ever heard of. This lady's bananas. How did she do it? Then walk away from that conversation of being an entrepreneur, because it's not for you, because it's terrifying every day, all day. And you have to want that. And yeah. And just be one with it. Like, just be like, okay, if this is like, this is your litmus test. If this is terrifying you to the point of like, I don't think I could do it, then you probably can't. And then just stop wishing it and do amazing stuff in your thing. Go the highest you can in the hospital, do the highest that you can in your practice. But if every time you hear a story, there's this thing inside of you that's like, man, like, there's people who hear it right now, they're feeling it as I'm saying it.
Yeah.
Then just effing do it. I curse a lot, so this is hard for me. Then just effing do it. Jump. It'll work itself out. I promise you it'll work itself out.
That is such a great, like a total great pitch for that, because it is true. Like, if you are afraid, it's just going to get scarier. So don't do it.
It never gets easier.
It never gets easier. But if you're like, no, that sounds amazing. Like, how do I take a bet on me? What does it look like? I see that she just jumped. I want to jump. Like, if that's where you are, you've got to feed that beast, because it's just going to, you got to feed 100.
It. And if it's not where you are, then feed the other beast and let this like just be done with this conversation. And that's okay. That's totally okay. And just be like amazing at what you're doing.
Yeah. And there's enough nurse practitioners on my podcast that have shown how to do that other part, to be super successful, to find other side hustles while they're doing the one job at the hospital, because you don't have to just stay in that one lane of, I'm just going to go work my, Monday through Friday. And no, learn how to precept students, learn how to open up a little side thing. You don't have to do it where it's your full income, but you can do little side hustles and gigs that you're like, all right, yeah, I'm cool. I do this certain days. I do that. And you've got variety, so that if you want to see, like, am I diversified? If the job is just like, listen, you got to go, then you're like, oh gosh, I've got nothing else ready. So that's what I really advocate for on here as well. But go ahead.
100%. No, 100%. You're 100% correct. I was just going to say, this brings me, you just mentioned something, the precepting brings me to the next business, which is, well, actually, let me skip. First, as the business got bigger, I promised you I'll show you the problems and how I solve. As the business got bigger, I realized in order to continue to provide amazing care, I need a scribe in the room, because you don't want to do this. Yeah, what were you saying? Right? You don't want to type. For those of you listening and not hearing, you don't want to type and not look at for those of you listening and not watching, not hearing, sorry. You don't want to type while you're talking to your people. But the amount of volume that we got in my practice, we're seeing 70 to 80 patients a day per provider. Yes. And nobody feels rushed. If you look at our reviews, there's not a single person that feels rushed. We have our workflow down to a science. But one of it is that you need a medical scribe. It's because the medical scribe, we're legit. So you don't have to do 70. We're crazy. Okay. So
wow. Per
provider. Yeah. Wow. We have active patient roster of 20,000 patients at this point at EG Healthcare. And by the way, if you don't already follow us on Instagram, you should, because we're so funny. It's just funny.
Dr. E, this is great.
Wait, I didn't even get to the big part yet.
Okay, keep going.
So we get this. So I had a scribe in the office at the time, and it was great. But when she left, I was like, wow, I can't really be dependent on this one person if she's on vacation or whatever. And it's really important for the provider experience, not to chart all day, but super important for the patient experience that they get my full attention. I'm looking in their eyes. I'm here and I'm not on the computer. Somebody else is typing, right? So it's super important. So I reached out to a virtual company, and, they're based out of India, and we started, it was a virtual, the scribe is in India, and they are listening in, and then they do the charts for you. And then I realized I could probably run this company myself. So I opened up my own scribe company. I'm going to skip some parts. Opened up my own scribe company in India. My scribes are in India. And here's the cool thing about it. It is run by women who truly are not allowed to leave their house to work, right? Especially at nighttime, because there's a time difference. So they are allowed to work from home, and their families are happy. So they're able to put food on their table while their families are able to observe them, because women are not allowed to go out at night, and there's just cultural issues there, right? So we're empowering this whole group of women in India to be able to work and provide income while meeting their cultural norms. So it's just been like this crazy win-win. Initially, I was using Scribes just for my company, but then my colleagues find out about it. And so now my colleagues are using my Scribes. So it became its own entity. So that's business number 2.
Wait, yes, business number 2, because you've acquired 2 other businesses.
Well,
but that's
EG
all wrapped up in the one.
There's one. It's just
yes.
one. Yeah.
And then the Scribe. Okay.
The Scribe. And then number 3 is G Prep.
Okay.
I'm E, by the way. G is my wife. So that's why everything's G. I was mentoring a lot of NPs, and you just said it. The education is good, but the clinical, I feel like, could be better.
Yeah.
This is something that can be listened to in other places. So really careful with my language.
Yeah.
And so it's amazing, and we are prepared, but there is a bit of a leap once you graduate to really feel comfortable in the exam room, where what we don't have is residency, right? Where you get that comfortability. And yes, there's a comfort as a nurse, but it's a little bit different comfortability at NP. So EG Prep is designed, it's an education company. It's like a 2-day workshop. We're launching it officially January 2021. If you want to, it's in Staten Island Hilton. It's a 2-day workshop with really specific
modules. January
modules.
2023?
I'm sorry.
You said
January
2021.
21st and 22nd, this coming January. Is that 23?
Okay. Yeah.
21st and 22nd of 2023.
Okay.
And it's a 2-day, we hope to run it 2 or 3 times a year, 2-day workshop with specific modules, not academic, like clinical, like approach. That's going to be approach to the patient with headache. So we're going to walk you exactly what the pitfalls for headache, approach to the patient with back pain, because you already have all the information. You already passed it. But we're going to help you assimilate it into what you need in the exam room. So we're super excited about that. So that's business number 3.
So that's number 3. Okay.
Yes.
And number 4.
Number 4 is the biggie.
Okay.
Number 4 is not called EG something. It's called The New Method, but new is spelled with a K, because you always knew there was a better way. And that came from the fact that my wife was sick a few years ago. She has an autoimmune issue, and conventional medicine really failed her. Mm-hmm. And we turned to something called functional medicine, and it really changed our lives.
Wow.
And so I realized I had to bring it back to my patients. So I started slowly, and that's why I eventually got my PhD in integrative medicine.
Integrative medicine. Yeah.
Yeah. And then I invented the new method. So it's like a specific application of my knowledge, and we're national. So we have clients, because you can't call them patients. They're not patients because we can't practice medicine out of the state, but we have clients all over the country who need functional medicine support. So those are 4 businesses.
How did you keep up with the volume? My goodness. I mean, I hear the Scribe, okay? And then somehow the Scribe ends up turning into a business, but okay. And then, so that helps you keep up with your clinical work to a certain extent, because you still have to manage the practice, which is, as the CEO.
Sure. Well, I have a big team at this point.
Yeah. You've got managing people, which is a ton of work. And now you run these other businesses. How are you doing all
Well,
this?
EG Healthcare, as it grew, I hired other NPs. So my NPs, I only practice primary care once a week at this point, because the rest of the time isn't functional. I have a team of about 20 locally. I have 2 people in the Philippines. I have obviously a few people in India. So it's thing.
Wait, why do you have people in Philippines? Is that for the Scribe business as well?
No, one is for my billing, and one is to help us with writing articles for our blogs. So the team is just
okay.
It's never ending, right? Because we have, so EG Healthcare, and then the new method. Remember, the new spelled with a K. I always like to say, because people are listening. Yeah. If you look at our social media, it's intense, and it's its own machine. We produce content. I spend all of Tuesday just producing content for the week. So we produce content all the time. There's nothing haphazard about it. So we need a team. There's a team for everything. So part of that also is creating a lot of content blogs. So we have someone in the Philippines that helps us with that.
Yeah. And that helps with like SEO. Is that what you're trying to kind of help?
Exactly right. So that helps with SEO. And then there's a method to manage. So I have a whole team that manages EG, and then I have a new method team. And so it's a lot.
Yes. So for those that are like, wait, Cedar just said SEO. What is that? So that's search engine optimization. So it's to get her company name out there. So when you type in healthcare, she's the first one that pops up. The more content you put out, like evergreen content, right? That ends up driving people to you, from what I'm understanding. I'm still new with this whole thing.
No, it's good.
I know how to drop terms, but like, I'm like, so is that a SEO?
I'm glad you said that, because a lot of times I've found myself in places where people are saying acronyms and I had no idea what they were, and I'd have to Google them. So let's not be those people, right? I really love that you brought that.
So
SEO, for any of you up and coming entrepreneurs, it is not enough to just have a website. Great, I paid somebody $1,000 and did my website. That is worthless. That's like just having a piece of paper, like a flyer hanging up in your wall, and no one sees the flyer. People have to come to your website. Just owning one is meaningless. So there's a few ways you could bring people to your website. One is paying, like you pay Google ads. So like every time somebody says knee pain, if you're an ortho, it'll come to you. But for those who don't have deep pockets, SEO is another way to do it. So it's more organic. And so your web guide, this is not something that is shouldn't be in your purview if you're clinical. I mean, if you're NP, that's also web, awesome. But you need to have a web person who understands that they need to build a whole bunch of stuff in your website that you might not even see with your eyes to help drive the Google robots to your site. So if someone says, I'm looking for a doctor in my area, doctors near me, there's a whole bunch of stuff that happens in the background that will bring them to your site. That's SEO. And there's a talent, there's a skill for it, and you have to make sure you're hiring somebody that helps you with it. So what I was talking about now is that the more content you have on your website, whether people read it or not, it's really about the Google robots. So we create blogs every week about various topics. So if somebody searches, I don't know, headaches, and they see my article, it will lead them to the website. So there's just a whole world around it. And so it's part of a strategy. Do you need to do it right away? No. If you're just opening up your business, this is not your top priority. Should it be on your list of things to do? Yes.
Yeah. So what else do you feel like has contributed, besides acquiring other businesses, to your growth as a practice? What would you say if you had to kind of go and pinpoint and take a needle and just go, this thing right here has been a game changer? What would you say?
The team, 100% the team.
Yeah.
You have to be about your team. If you're going to be a business owner, you have to be about your team. The patient, I have to say, is important. But if your team's not on point, I cannot tell you how many people have come to me because they said, I love Dr. Smith, but I can't stand their front desk. So I've left Dr. Smith because your team is so nice. The only reason my team is so nice is because they're my top priority and they know it, which means I try to pay them as best as possible. If somebody's rude to them, I will never take the patient's side. My patients know this. You're rude to my team, you're getting discharged. So my team knows I have their back. You write a review about so sometimes you write a review, most of them are like 4.8, which is a lot considering our volume. Yeah. But if you write a negative review and say the front girls don't know what they're talking about, my butt will be writing back and say, if you mean screaming at my staff as you saying that they don't know what they're talking about, blah, like I am going at you because I treat my team like my family. And that doesn't mean they're all with me for years. I have a core team that's been with me for years and some come and go. That's the nature of the job. Not everyone is a front office person forever. Yeah. But when you're a part of EG, you're behind the line and I got your back. And that also means if we structure things like if you need a microloan, we're going to give you a microloan to help you out. If you have a situation at home and we have your back in a lot of places when you work at ED. And we've had some weird situations and we're like, what do we need to do to get you where you need to be? If that means we've had people who even had issues with drugs and they were willing to do the work, we were willing to keep them on, so there's things that you can do for your team. If your team knows you have their back, they will have your back at the front, on the phone, everywhere with the patients. They're going to smile to the patients. They're going to be kind to the patients. So it's all about the team, always, all the time.
So what you're talking about is reminding me of this book. That's why I said Built to Last, Good to Great. I can't remember the author's name, but he wrote a book on getting the right people on the bus. That was his whole concept. And another book that I love, Dave Ramsey, he wrote a book on the entrepreneur. He also describes his team. And the way that you just talked about your team is the exact way that he talked about them in his book. It's like this guy, his wife had passed away in a car accident. He was away on a trip for the company. So he described in the book that he flew a private jet out to get this guy from wherever he was and flew him back home so that he didn't have to drive back from this event. He flew a private jet out to go get him. And when I heard that, I just thought, my heart just like broke. I was like, how much does he care about these, like the little people in his company, that he was like, Dave Ramsey was like, I'm getting a private jet charter to go get this guy because he's going to find out and he needs to be able to get home in 40 minutes, not 7 hours, you know?
Right.
And so just that whole mindset. And then in the Good to Great book, he talks about getting the right people on the bus. And that whole concept is just this idea that everyone has a spot that they could be in, and you've got to get them to their right seats, because once you get the right people on the bus, it almost doesn't matter what the mission is.
Yep.
They're going to pull, like, because you got the right people in the right spots. And then the leadership aspect that you're talking about, that servant leader, that heart of like, my job is to just take care of these people, because in turn they take care of me, and we're able to keep this
100%.
system going.
And they know, the girls who've been with me from the beginning, they know I never got a fancier car. I didn't get a fancier house. Every time there's more, we give more benefits. So at first we had no benefits. Now we do. And we grew from nothing, just, hey, this is all I got, to like, we have a package now that we can give you, right? We didn't have that. And it didn't have to be that way. I see my colleagues. I could just be like, great, more for me. And that's just never going to work out. That type of mentality, that's just not a long-term mentality. It's old school. School.
No, that's what he talks about as well. The giving.
And we do as much as possible. I mean, we can never be work from home, right? Because we provide direct patient care. Yeah. But we could really be cognizant of work-life balance. So that means we take turns staying late, because in medicine, you tend to stay late. So we try to make it where not the whole team stays late. Tuesday's your day to stay late. So you can plan your life. You know, Tuesday is not a good day to plan an event, but you know that the rest of the week you are out on time, so that you can plan your life. And that's really important. So there's small things that we put into place to, the team used to work every weekend. And then one of my really good team members said, I really can't do this every weekend thing. And I said, you know what? We could split the team in half, but you'll be a skeleton team. But as long as everyone's down with like stretching themselves on the weekend, then we'll alternate weekends. And we did it. And everyone's so much happier because now it's alternate weekends. So it's harder, but they were down for it, right? So there's so many things that you can do creatively that doesn't cost the business more money to do that. Making sure that everyone gets out on time and only one person stays late, that doesn't cost you more money. So there's so many things that you can do. We close down for lunch every day between 1:30 and 2. Phones, go for lunch, no conversation. You have to eat. There's no, and I get agitated. I'm like, let's go downstairs or go eat. You need a break. No, I'll work. No. You have to go. You'll burn out. We close Fridays because it's really critical, especially with direct care, because people are people. It's a lot. And you need to take those moments to yourself. And so it's really all about team. So that is the pivotal thing, which then translates, in my opinion, to superior patient care, because the team's vested. And so superior patient care, it keeps them coming back, obviously, right? And so that those are the two things. So
along this way, have you had any mentors? Has anybody like mentored you through your process?
Yes.
Or have you just been a single lone wolf?
No one does this alone. No. Mm-hmm. And that's really important, because then when you're on top, you have to pull others up, because you did not get here by yourself. I don't care what rhetoric, I don't care what politician, nobody got to where they are by themselves. That's a bunch of BS. And so when you're on top, you make sure you bring everybody up with you. First and foremost, my wife, no joke. She is the moral compass in my life. So if there's something I'm not sure, like, am I in a gray area? If Gina thinks this is no good, it's no good. We just walk away. So that's first and foremost. And then mentors along the way, always. And I pay a lot of money at this point for my mentors, because at first it's colleagues, but then it's coaches and mental health coaches and people who have done it better for you. And you pay for their time, because you cannot, especially when you run your own business, it's just you and the walls. Yeah. Who are you asking? right? And everyone who works for you works for you. So you're the one that's supposed to have the answers. Pay money for your mentors. Make sure you get mentors. Put your ego aside because you don't know. And you don't even know what you don't know.
Yeah.
So, and I forgot the most important thing, God and the universe. There are moments when you're just like, there are times when you plan things and God's like, I'm going to let you know that's not actually the plan. And you just have to be like, okay, my man, my bad. I got you. So a lot of faith. But mentors, yes, you need mentors all the way.
Yeah. And it sounds like you're paying for mentorship.
Well, at this point, I'm paying for mentorship. But, I'll tell you a small story of when I first started at EG Healthcare, it was a tiny little blip. And I turned to, I'm going to mention his name, Dr. Frank Scifuri, because I can never forget his kindness. And he's big time on the island, in Staten Island. And I turned to him, I was like, hey, kind of scared of him. And he's like, there are enough patients for me. There are enough patients for you. Whatever help you need. He did not know me from a hole in the wall. Whatever help you need, you are not competition. They'll come to me. They'll come to you, whatever you need. And that was such a turning moment for me because he did not have to do any of that. And he helped me along the way for nothing, for no reason other than he's kind. And so I try to mention his name all the time. I thanked him in my book because that was really impactful because he could have totally been like, why are you wasting my time? I'm not even going to meet with you. He met with me. He was kind to me. He's gotten me out of a lot of situations I didn't know what to do next. Until this day, I call him and ask him, Frank, are you closing for the snowstorm? And if he says yes, then I'm closing until this day. So
what is so funny as you were describing him, one of the things that I think a lot of nurses, and I don't know if it's just the mentality that our group has, but we tend to think we're in competition with one another. And I think it's because we're a women-dominated field. I think it's just a woman thing. I don't really know. I've tried to look at it from different angles and try to figure out why. But that is an abundance mindset, which when you have an abundance mindset and you're thinking that there is plenty to go around, there are not problems, you only see solutions or at least opportunities to grow solutions. These different things where like the scribe business that you were talking about, like that was a problem. Like you were just kind of like, this is an issue, but you looked at it as an opportunity and then you ended up turning it into a business. And so it's like, if you keep that mindset of abundance, one, you attract good things to you. And two, as you operate out of that abundance mindset, you begin to make more money. You're able to generate more revenue. You're able to come up with new things instead of thinking, I'm in competition with everybody. We're playing the game of spoons. 100%. There's one less spoon. We're all going to end up, some is going to end up without. If you don't think that way and you change
you don't think that way.
The environment.
And I'm going to add to that, the abundance mindset for me is also, and you must give. And you must give, because to me, I feel like he only gives me as long as I give to others. If at any point I start to like fill my coffers, I know the faucet will stop. This is just, I just know this. I don't know how I know it. I just know this. So you must give, you must help others, because if you do, it'll just keep flowing your way.
Yes.
It will just keep flowing your way. That doesn't mean you can't use it. Of course, I'm not saying you have to, live in misery, but you must give.
Yeah.
If you give, you will just have more.
You are the first guest to say that. And I think it's a huge point to sit on for a second. Again, I don't think that we realize, and I talk about this all the time, that there are laws that govern the universe. It just is what it is. And so when you have a baby, do you expect the baby to come in 3 days? No, like you hope it doesn't come in 3 days, but you get what I'm saying. 9 months. Yes. Okay. That's when the baby is born. And you plant what do you call those big trees? Live oak tree. And you plant a seed in the ground. You don't expect to have a live oak that's able to provide shade. Yeah, that live oak got there after 100 years of sitting there and enduring the storms and enduring the storms of life that have come through that area. That's what made that tree strong. And it's the same with the concept of giving, that if you give, it always comes back. There's a law. It governs the world. It just is what it is. Accept it. So just give it away and watch.
Yes, you give it away.
Come
My
back.
wife always says, she's like, you are bananas. I'm like, no, I just have to give it. Person comes my way, I have to give it. My wife rescues animals and I rescue humans. That's what she tells me all the time. I'm like, just give it. It's fine. It's fine. Sometimes people take advantage of me. I'm not going to lie. Sometimes people take advantage of me. Sometimes the staff is like, you're never seeing that money again. I'm like, that's okay. That's on them. That's on them.
Yes. Gary Vee talks about that all the time as well. Another guy I follow. He's super great. And just, oh my gosh, he just completely puts his mindset in like, I know I'm going to get taken advantage of. It's okay.
Yes,
and when you
it
have
happens.
that resiliency of like, if I get taken advantage of, I know that there's something else, or for me, someone else looking out for me that's not going to
Yes.
let me fall. You move
Exactly
with such
right.
confidence and you just let it go.
Exactly.
You're like,
Yeah.
all right.
And it's on them. That's like their karma that they took
them.
and
Yeah.
didn't stand by their word, whatever their word is. That's for them to figure out. I don't have to worry about it.
I totally agree. Man, well said. So if you could go back to Dr. E as a med-surg nurse and give her a little piece of advice.
Oh my God.
Something that you would tell her that you wish she would have known earlier, what would you tell her?
I wouldn't tell her anything.
Really?
Yeah, because you have
the first one to say
go.
that too.
No, you have to go through the trials and tribulations. Like people say, if I could go back and fix it, no, you must fall, you must fail, you must be embarrassed. And God, I messed up publicly many times. You have to go through that to become the person you are today. And if I was to change any of that, I wouldn't be who I am today. Like the woman that stands before you now full of integrity is a woman that failed in integrity, in the past and had to see the circumstances of failing and hurting others and learn that lesson so that can become the person of integrity. And if I didn't do that back then, I wouldn't be the person I am now. So nothing. I would just watch her and be like, sis, let's watch this.
Love that answer. And you're the first one to give it. Fantastic. I love that one.
Thank you.
And
Thank you.
For the rapid fire portion, this is the fly by seat of your pants. You got to get ready. It's rapid fire. You ready? Here we go. What time of day are you most inspired?
Morning.
Okay. You're an early riser. Get it,
yes.
Get in there.
Yes.
Okay. Oh, how do you answer the phone?
I don't. I don't. You better text me. I don't have people who answer the phone at this point. I don't. Anyone who knows
that was really funny.
And I'll tell you how I answer the phone. What's wrong? Why are you calling me? Is this an emergency?
Why did you text me?
Bye.
That is very funny. And what subjects in school did you find most fascinating growing up?
Oh my God. Most fascinating is what I did my first degree in English literature. I loved literature. English lit, my first degree, English lit. I did English lit. Then I went back to nursing. My dissertation and my
sorry, that's medicine. What I meant to ask.
That's okay. Yeah. My dissertation I did on the effect of what we call it orthomolecular nutrition, but anti-inflammatory nutrition on tinnitus, which everyone on TikTok says is pronounced tinnitus. So I don't care how you pronounce it, but anti-inflammatory diet effect on ringing in the ears. Pronounce it any way you want. Because what I discovered with my patients, incidentally, I discovered that when I cleaned up their diet, the ringing in the ears went away. Tinnitus. And so I did a kind of retroactive because I already had the data. And I was like, how the heck is this happening? And then I uncovered that, in fact, for a huge population, tinnitus is a sign of inflammation, right? Not the trauma or the cops or the soldiers, those are trauma and hearing loss. But to a lot of people, it's actually a sign of inflammation. And when we take away the anti-inflammatory foods, the ringing in the ears goes away. It's been fascinating. I have patients who are like, I've suffered. That's my dissertation was on.
Yes. And then I'm sure you probably use this in your, I'm going to say no with the K.
The new method.
Oh man, I messed it up. Okay. New method.
You're good.
So is that with your new method business? That's the way you're kind of implementing that practice. Okay. That's cool.
Yeah. We have a software that we use. And that question was always in there. And I was like, what the heck's this question about ringing in the ears? I ignored it. But I would keep seeing like it was going from like a level 10 to level 2. And I started asking my patients, and they're like, oh yeah, the ringing in my ears is gone. Like they came in for joint pain or brain fog or they're autoimmune, and the ringing in the ears would go away. And it was during the time that I was in school, and I was like, this is what I ran my dissertation on. So see, God took care of me again. I didn't even have to figure it out.
That is so cool. Well, thank you for coming onto the podcast.
Thank you so much.
With my guests, your journey. It's incredible. Thank you so much.
Thank you so much.